It is essential to know the stages of labor and delivery before you deliver. Dr. Shelly Batra tells us more about these stages and what we must do.
When labor pains start, there's a lot of apprehension and there's a lot of anticipation as well. It's an exciting event and we must prepare ourselves physically and mentally for this event. There are 3 stages of pregnancy: first, second and third. The first stage of pregnancy is from the onset of labor till full dilatation of the cervix. How does labor start? Labor starts with pains. The first sign of onset of labor is periodic pains that come and they go, and in between contractions the patient is absolutely comfortable. Sometimes there can be a gush of blood, there can be a gush of water, there can be blood mixed discharge as well. And when the doctor examines the patient, she finds that the cervix has started dilating. This indicates that labor pains have started and the patient is in the first stage. Now, during the first stage, the pains become more and more intense and they become more frequent. And these pains result in descent of the baby and dilatation of the cervix, which is very much desired because the baby has to come down into the birth passage, the cervix has to open up. And when the cervix is fully dilated, we say the patient has entered the second stage. The second stage is the stage of expulsion of the baby from full dilatation till the baby coming out into the world and taking its first breath. That is the time the cord is clamped. The pediatrician attending the delivery will take the baby away, do the suction and take care of the baby. And the obstetrician waits for the third stage, which is the stage of expulsion of the placenta. This is the stage where one has to be very careful because the placenta should separate well within the stipulated 30 minutes. There should be no excessive bleeding. The uterus after expulsion of the placenta should contract firmly and soundly so that all bleeding stops. And if there are any cuts that have been given, then there should be no torrential hemorrhage, minimal hemorrhage that is sutured immediately. So management of all 3 stages has to be taken care of with the help of the patient's family. In the first stage, the patient can be ambulatory in most cases. She can walk around, talk to the husband, interact with the family, and of course get the fetal heart checked and the other tests done periodically. In the second stage of labor, when the baby is being delivered, sometimes the husbands are prepared to assist in the delivery, they are motivated, they are trained to do so. And if that is so, then they are very welcome inside the delivery room. The third stage of labor, nobody is needed except the operating team, the gynae team, and they are the ones who manage, so everything goes smoothly.
For more videos related to pregnancy and health, log on to onlymyhealth.com.